So my name is Dean Laganosky. I'm a board-certified urologist in Philadelphia, Pennsylvania. I practice with Solaris Mid-Atlantic Urology, a large private practice group. My specialties are really complex voiding dysfunction, minimally invasive procedures, both for benign and malignant conditions that affect the urinary tract. So with Optilume BPH, we talk about a minimally invasive outpatient procedure that takes about 20 minutes. This is one where we won't expect cutting or burning or resection. It will require a catheter afterwards. My general protocol is 2 days if they are voiding freely beforehand, potentially a little bit longer if they were catheter dependent prior to the procedure. My framing of their post-operative period is really, you will likely have some irritation with voiding, burning sensation, a feeling of frequency or urgency, and some blood tinge with your urine, but far less than we would typically expect with a more resective or vaporization procedure. Our cohort of patients who have moved forward with Optilume BPH involves both small prostate gland patients and very large prostate gland patients. Optilume has done very well even for large gland sizes, and those are individuals who may not be able to even urinate or be catheter dependent beforehand. One of the first patients that we treated was actually a catheter dependent patient for about 6-month period with over 130 gram prostate. Within 2 weeks after the procedure, they were no longer requiring catheterization and are still voiding freely a year and a half out of their procedure. Yeah, so prostatic urethral measurement is really key because it's going to help us when we're determining what balloon size to use for an Optilume BPH procedure, or really how we select a procedure for a patient in general. So I find that the best way to do this is a formal transrectal ultrasound that will allow us to measure from the base of the prostate gland to the apex to really make that determination. So there's a lot of variability and user dependency in terms of how you measure prostate length or size with an ultrasound from provider to provider. I find that the best practice is really getting an individual to a specialist who does a lot of this type of work, and then developing a pattern where you can work through an ultrasound as well as a procedure consistently to get the best results. With Optilume BPH or any other procedure, what I've found is the best way to achieve the best results is to efficiently work through the procedure and to have a process. I generally am thinking one step ahead in terms of how I can get that patient through a procedure and being thoughtful about the manipulation and the steps that I'm taking. When I go in, I try to be as little traumatic to the tissue as possible. I am looking to place that balloon in an optimal location that will give the widest channel. And then I'm looking to have that balloon be set up for success to deliver the results it needs to, while giving that medication to the areas of the prostate we're trying to address. After that balloon is deflated, I then work efficiently to try to get my catheter in an appropriate spot, to do the bladder irrigation, to put that catheter on tension quickly, and then to start our continuous bladder irrigation. And that way we achieve results that are consistently good with minimal hematuria. My protocol is no controlled pain medications unless absolutely needed. We typically will manage with bladder antispasmodics and an antibiotic after the procedure. I generally have worked into a protocol where a patient gets a standard dose of an anticholinergic or bladder antispasmodic after the procedure in the recovery room, and they have a prescription for a similar medication for going home. Patients who come to see me and ultimately elect to get the Optilume BPH procedure are very happy that they did in general. I think that they find that this is consistent with what they were researching beforehand, which is a well-tolerated, minimally disruptive procedure that allows them to achieve substantial improvement into their urination pattern. Many individuals reach their final voiding pattern a lot sooner than some of the other resective or vaporized prostate options. And many of the individuals actually have a more straightforward recovery period because this is less disruptive to the anatomy.